Hi, I'm Dr. Mukesh Gupta from Lenest Malad. Towards the end of the pregnancy, one of the anxieties which keep troubling us is, Doctor, will I have a normal delivery or will I land up with a cesarean section? Well, before we even move ahead, let me tell you that whenever you want to compare, just remember that normal delivery is one of the most superior options available for you. And there's no doubt that given a choice, you should and definitely try to have a normal delivery. Cesarean section is an artificially done process where an incision is taken at the lower abdomen to get the baby out from the uterus. Although over the years it has become very safe and a very systematic protocol because of the advent of standardization of practice, because of the advent and availability of surgical techniques with aseptic precautions and good antibiotics available, it is much more safer to have a delivery by cesarean section than what it was in the historic times. But still, normal delivery is a process which has been there through evolution. Now, if you land up with cesarean section, what are the circumstances which lead you to that? Let me make it very simple. If there's a reason for which the baby cannot come out, that is, there's a cephalopelvic disproportion or the way is less and it is getting obstructed, leading to extremely prolonged labor or obstructed labor, then there is no doubt that we have to get the baby out by cesarean section. Two other circumstances where there is a risk to mother's life or risk to baby's life, as in fetal distress or some infection that the mother may be having, which will be passed on to the baby if the baby delivers by cesarean section, normal delivery, then we have to choose the option of cesarean section. Sometimes it's a crash emergency like a fetal distress or cord prolapse or abruptio placenta, where the placenta is just separated out before the baby has been delivered and that has led to bleeding inside. We have no choice but to do a cesarean section. There may be a situation where the placenta is in an abnormal position. Instead of being higher up, it is lower down. So it means that whenever the cervix gets opened up, there is going to be bleeding and it will separate before even the baby is delivered out. We have no choice but to do a cesarean section. Sometimes the baby has chosen to play a little bit of mischief and is not in a proper position. Say for example, baby is in a breech position where the head, which is normally on the lower side, is now on the upper side and the baby's bum is on the lower side. In such situation, a cesarean section is a preferable method if there has been no earlier normal delivery. The reason being that the head may get stuck after the breech being delivered, and there are many more such complications which are there. If the baby is in a transverse lie, or if the baby is in an extended head position where the diameter of the baby's head is larger than the pelvis diameter, again, it will not be possible to have a normal delivery. So in simple words, the situations which prevent the baby to come out, the situations which can increase the risk to the baby's life, or situations which can lead to increase the risk to baby's long-term outcome like morbidity, we call it, as an infection or other such things, or development. And lastly, in the best interest of the mother, your doctor would choose this option. Put efforts to choose the right doctor, but once you have chosen, have faith in that doctor and let him choose whether your baby is best suited to come out by normal or cesarean section. Trust me, your chances of landing up with that cesarean section is hardly 10 to 20%, or maybe if there's a complicated situation more. But most often than not, you are going to land up with a normal delivery. And remember, something which Mother Nature has developed through centuries of evolution is definitely going to be superior than a technique or a method learnt over a few decades by surgeons. Choose a normal delivery if possible.